Hello everybody and welcome to this session of the Overview and Scrutiny Commission. I've received apologies already from Councillor Eggleston, who I think is online. Yes, online, now online, and Councillor Forster and Councillor Frost and Councillor Barnard. So I don't think there are any other apologies. The minutes of the previous meeting, agenda item 2. Does anybody have any comments from the meeting on the 9th of January? Any amendments, any suggestions? Nope. So if everybody's happy, then I think we can agree the minutes have been accepted. Agenda item 3, declarations of interest. Anybody working under the party whip? Does anybody have a declaration of interest in that capacity? No. Agenda item 4, urgent items of business.
No, Chair, there have been no urgent items of business.
Thank you. And agenda item 5, public participation.
No, again, Chair, no public participation requests.
So we can move on to the main part of our agenda, agenda item 6, the strategic health update. We have people joining in person and online for this agenda item. So I'd like to welcome colleagues from Frimley ICB. Thank you very much for joining us. I appreciate there are a number of you here today. So it'd be great if you don't mind introducing yourselves now. We'll start in the room and then move online, please. Thank you.
I'm David Mpanza. I'm the Head of Primary Care for East Berkshire.
Thank you. Welcome. We'll move online.
Shall I go first? So, hi, I'm Annabelle Buxton. I'm a GP at the Waterfield practice in Bracknell, and I'm also a clinical lead and represent Bracknell Forest in this space.
Thank you. Welcome. I don't know your name, so I can't call you.
Sorry, I'll go next if you like. So I'm Tracy Faraday-Drake. I'm Director for Children and Young People, Learning Disabilities and Mental Health with NHS Frimley. And I'll hand over to my colleague, Alison. Ali?
Hello, evening everybody. I'm Ali Woodywist. I am Head of Transformation for Frimley ICB with a special responsibility for children's mental health, special educational needs and disabilities, and all-age neurodiversity.
Tim, would you like to go next?
Yeah, I can go next, yeah. So I'm Tim Langburn. I'm Interim Director for Pharmacy, Optometry and Dentistry for Frimley ICB.
Thank you. And we've also got Louise Noble here as well. Louise.
Thanks, Tracy. So hi, I'm Louise Noble. I'm the Service Director responsible for child and adolescent mental health services, all age learning disability and eating disorder services for Berkshire Healthcare.
Thank you. Thank you for joining us. So this agenda item was requested as the Commission has a responsibility to scrutinise our strategic health issues across the borough, and this includes dentistry, GP, surgeries, child and adolescent mental health, which we'll refer to as CAMS, which is why you're all here representing those parts. Our partner organisation representatives are here today to give us an update on these issues, and I believe we'll be starting with a presentation about primary care. So please can I invite David, the Head of Primary Care, and Dr. Buxton, I think, Annabelle, the clinical lead, to speak. Thank you.
Absolutely. Thank you, Chair. I think we have got some slides, and I think, Louise, have you got those ready for us to kindly share?
Sorry, yes, just put them up.
That's lovely. Thank you.
There we go. We can see it on our screen.
That's super. There we go. That's there. So we can move on through to the next slide. That would be great. Thank you. So we thought it might be helpful just to give a little bit of context in terms of general practice services and access to general practice and the changes that have occurred over the last few years on there.
Sorry, one moment. It's not moving through. Bear with me. Is that presenting and moving through now? Yeah. Sorry, that should be fine now.
Yep, go ahead.
Thank you. I can't see those on my screen on there. There we go, that's lovely. So we thought we'd talk through the national picture and landscape, the access model that most practices are implementing, capacity, and some of the restrictions such as the estate picture across the locality as well. Next slide. So there have been lots of recent reports that have been commissioned in the post-COVID era, looking at details of recovery plans in terms of access for primary care. More recently, we've had the Darzi report and looking into integration of services into neighbourhood teams. We've had Claire Fuller's recent report, and we've had lots of detail in terms of what a modern general practice could and should look like, and moving things forward. So down at the bottom there, you can see probably the most detailed aspect, which is the modern general practice aspect, and talking through that element on the next slide might well explain some of what has been proposed and what's been happening over the last couple of years. So next slide, please. So quite a busy slide on there, but effectively what we're looking for can be encompassed in this bottom aspect with the pink section in the centre there. What we're trying to do is to move sort of unscheduled care into scheduled care with sort of every contact counting on there, and moving that into what we call proactive care. So effectively looking after patients at an earlier point in their journey with a view to them having more years of good quality healthcare and living and staying well. In terms of the ask, we've been tasked by NHS England to transform access to general practice, and that's been happening in a variety of ways. One of those ways is that we've been asked to go effectively from analog to digital, and most surgeries have done that in two ways. Number one, upgrading their phones and their software. So a lot of surgeries are on internet software and VoIP software, which not only encompasses a callback function for patients rather than having to necessarily wait in a queue, but also then being able to transfer them to appropriate avenues so they can access care the first time without having to contact surgeries back. The other aspect on this left-hand side that you can see is that we've been asked to provide a digital front door, and that's been a big change for both surgeries and for patients on there. We fully appreciate that not all patients are digitally enabled, so to speak, and can't always put a request from an internet site or website on there. So with the digital front door, patients have the option either of filling a form in through the website or through some of the associated apps, such as the Healthier Together app for children, or our care coordinators and receptionists will fill that out for them over the phone for them if that's easier. Or in fact, patients can come into the surgery and fill those forms in at the reception desk if that makes it easier for them. And so the digital front door is designed to get rid of the 8 o'clock in the morning rush and patients being told to contact the surgery back the next day, particularly if those appointments are filled up very quickly and there is no further capacity. So it's to try and even out if you were to contact your surgery earlier in the morning, slightly later in the day, to try and make it a more fair process for patients, and so that clinicians can triage each of those requests and try and decide whether there's an urgent or a more routine need for care, and trying to map correct patients to correct appointments, whether that's through urgent care, whether it's through own GP surgeries or any of the allied professionals such as paramedics, etc., physician associates, mental health practitioners, etc., who will work within our surgeries on there. In terms of other aspects. This also hopefully provides improvement in terms of our urgent care aspect, and we can map our Bracknell urgent care appointments and make sure that we use all of those at the Branksbridge facility appropriately on there. David, was there anything else on this slide that you wanted to talk through at all?
Thanks, Annabelle. I think that other elements is just highlighting the importance of triage and why patients are asked certain questions when they contact the practice, and that's to help ensure that patients are going to the most appropriate clinician for the most appropriate conditions. So as Annabelle has mentioned with Branksbridge as a perfect example, that site is about sending patients there who just need to be seen and treated, and continuity of care might not be the most important aspect for them, ensuring that the practice staff are available to provide that continuity for those patients who do need it.
That's really helpful, thank you. Next slide, please. Super. So in terms of access to general practice, I know this is always something that's looked at in detail on there. In terms of the context, so general practice receives a fairly small proportion of the overall NHS budget for the amount of appointments that are provided on there. But what we can see over the last few years is that actually general practice has outperformed any part of the NHS in terms of providing more appointments than it ever has done. And those numbers of appointments have increased over time. So top graph showing appointments over time, and the bottom graph on here is showing the appointments per 1,000 registered patients over time. And it is interesting that through COVID times, we fully appreciated that offering a variety of appointments to patients has proven quite popular. So often giving patients the choice, and for them knowing that they can ask for a choice of appointments, whether they prefer that to be telephone, which does tend to suit particularly, say, the working age population if it's appropriate, but also looking at the fact that for lots of the population, face-to-face appointments are also appropriate. And you can see that looking at the booking to appointment over the last month on there, that over 50% of requests for appointments were accommodated on the same day. And I think that's quite a significant figure. In my own practice, for example, just for context, we're a nearly 16,000 patient practice. On a busy Monday, you could get nearly 250 requests coming through the digital system. And obviously not all of those necessitate a same day appointment, but you can understand, therefore, these are quite significant numbers that we're discussing on there. Next slide, please. Interesting points. One of the limiting factors in terms of the number of clinicians that we can host and our plans for the future is that general practice estates are somewhat limited. We have some amazing facilities, such as the joint venture with the new Binfield surgery that's been built, but we also have a lot of practices that are in premises where they are full from a clinical perspective, older premises that don't support the current or future models of care, and there is limited ability to transform those. Next slide, please. There we go. So I think, David, was that all of our slides on there? I can see 21, but was that all the ones that we had for the time being?
Yes, from a primary care perspective, those were the slides we wanted to run through and highlight. Did you want to ask questions for all colleagues at the end, or?
Yeah, I think we'll take all questions at the end. So if you can carry on with the presentation, that'd be great. Thank you. Thank you,
Super.
Dr. Buxton. Thank you.
Thank you.
So Tracy, I think the next set of slides are yours.
Thank you. Sorry, just getting myself off mute and the screen. So we've got some slides to share, and Ali is going to take us through the first part, followed by Louise for the second part. So I'm not quite sure who's sharing those.
I'm hoping that Louise is going to share those for us.
Brilliant. Thank you. Thank you, Louise. So I'll hand over to Ali. Thank you.
Okay, thank you, everybody, for your time this evening. And we have shared with the panel a more detailed Word document with a description of some of the transformation work that has been happening with the specialist service CAMS in East Berkshire and specifically Bracknell Forest. We've all had sight of that, but the slides I'm going to take you through this evening with my colleague Louise from BHFT are a summary of the information that's a bit more detailed in what we've already shared with you. So there's 15 slides that we'll go through. Thank you. If we can go to the next slide. Thanks, Louise. So everybody is aware of the backdrop to the current provision around children's mental health across the country. And we have a record number of young people who are wanting to access a range of different mental health services. And we have seen a worrying upward trend in the level of mental health presentation, whether that's anxiety and depression, or whether that's more serious presentations among this particular cohort. And I think it's fair to say that much of this has also been exacerbated by the COVID experience and the pandemic. So we have a backdrop here, a context of high demand, and I think we have a strategy in Frimley ICB which is multi-agency, working with all our local authority partners, and we are working with 5 local authority areas, of which Bracknell Forest is one, and our voluntary sector community as well, to really work with that high level of demand and put in earlier help, so that we don't see as many children and young people needing the very specialist element of mental health intervention. If they get that help earlier in the pathway, they are much more likely to have the help that they need and to then not escalate into crisis, which is what we want. So there's a range of things over the last 2 years that have been happening, that have been put in place outside of our BHFT service provision, but there's also been transformation work happening with the CAMS provision as well. So this has been a simultaneous twin track of work. Can we go on to the next slide, please? So this slide is really just some of our kind of key insights into our Bracknell Forest children's population. It's full of interesting information, and I hope you've all had a chance to look at this. But what we know about Bracknell Forest specifically is that we overall have the lowest proportion of children living in the 40% most deprived areas across our system. However, we do see a similar number of children needing to access mental health services in Bracknell Forest as we do in the rest of our patch. And a bit later on in this slide deck, you're going to see a further breakdown between our 5 local authorities that will include Bracknell Forest as well. Thank you. If we move on. So we have a children's strategy across Frimley ICB. This has been contributed to by lots of key partners, including our local authority colleagues. And one of our 5 pillars is around a transformation of mental health services for children and young people. And this is just a very neat logic model that explains what we need to put in to the transformation work, what we're hoping to get out of the transformation work, and what are the long-term impacts. I'm not going to go through the slide in lots of detail, but essentially what we are seeking is a no wrong door approach. So whenever that young person presents, whether it's in school with a mental health school team, or at the GP, or on an online facility like a digital and health and wellbeing digital offer, then they will get the help and appropriate signposting that they need. So there is no wrong door, and there is no need to keep going back round to the front door again to get into the system. So that's the flexibility is what we've been working on, so that young people, wherever they're seen, get the support they need at the right time. Next slide, please. So this slide just explains a little bit about the things that we have done during the 24-25 period, and then the future plans for the remaining 2 years of our strategy. It's a 5-year strategy, so there are plans for 25 up to 27. And you will see for this particular year that we're in, we have had a range of new specialist services launch within the CAMS offer, to support some of our most disadvantaged young people. So we have a new learning disability and CAM service, which launched in last year in February. We have a couple of pilots looking at CYP mental health practitioners working directly with primary care. Now, we've been piloting that in Slough and RBWM, but we are discussing the rollout of that. We've been testing the pilot to see what the impact of having some specialist practitioners working in primary care, doing some intervention and signposting appropriately, what the impact of that has been. And our early evidence shows that it is having a positive impact. So that's what we have been trialling. We've completed the full crisis response that we've been working on for a number of years across the whole of Frimley. So this means that if a young person goes into crisis, again, they can get the immediate support and help that they actually need without having to go to a hospital. So there are crisis lines, there are crisis teams that can be accessed quickly 24/7, that children and young people can access. And that's been a national programme of work really to improve crisis response for children and young people. In addition, we have launched a psychiatric liaison service across our 2 acute settings. So this is a liaison service that is specifically looking and supporting children who are coming to hospital with a mental health presentation, and working with local authority colleagues and with community services to ensure that they don't have lengthy and inappropriate stays in hospital, not the right setting for them, and the right type of support and intervention isn't there. It is in the community where the specialist services are. And then there's been some other changes in the south that are not applicable, obviously, for Bracknell Forest. The next part of this slide obviously explains the next set of plans, and of particular interest to this panel this evening, we've got our Children in Care CAMS offer, which is launched and increasing in terms of its capacity. And we have a new mental health school team, which will be fully on board by January 26. So that's very specific to Bracknell Forest. And then lots of continuing transformation within CAMS services, which my colleague Louise will talk a little bit about in the second part of this presentation. Thank you. So I thought this would be useful for everybody to actually see the full mental health pathway that we have in Frimley. And this is very applicable to all of our 5 local authority areas. I think, you know, when we think about mental health services, we automatically think about CAMS, but there is so much more in the early help pathway that I really wanted to draw out for everyone's attention. So we have at the start of it, our digital health and wellbeing offer, which is Cooth, and some of you may have heard of Cooth. We've got some of those pilot roles operating in primary care where those young people might present with their families and their carers. We have our mental health champions and the local authority early help and those other support services, moving through then to the more specialist intervention, our mental health school support teams in a range of schools and colleges, through to face-to-face counselling services, which are provided by the third sector, and then through to our specialist service, which is CAMS, and onwards for those presenting with the most complex needs around their mental health. We move on, please. And then a couple of bits of data to show you. So you will see here the red dotted line is the national ambition for improving access for children and young people across all our mental health services. That's not just CAMS, that's all of our mental health provision, which I've just outlined in the previous slide. You will see that our plan, the Frimley plan, is the amber dotted line. And you will see that the blue line is our actual performance. So you will see we are above and have been consistently above the national ambition for quite some time. And I think our projection is continuing to tell that same story. Can we go on to the next slide, please? And this is a breakdown really of our mental health access by place. So we have 5 local authority areas that we are responsible for. The second top box is the most pertinent for this audience. So you will see here our Bracknell Forest figures, and you'll see a steady increase in terms of the numbers of children and young people accessing the range of mental health services that we have provided. And you will see also the kind of demographic breakdown in terms of access. And you'll see across all of our 5 areas, they are quite different. We have, 5 local authority areas that have some quite significant differences. I think Slough in particular is quite different from the profiling of some of our other local authority areas. Next slide, please. And now I'm going to hand over to Louise, because Louise will talk to you a little bit about what we're actually seeing in terms of wait times and in terms of numbers of children coming in to the specialist CAM service. I'll hand over to Louise.
Thanks, Sally. If you could take me to the next slide, please, Louise. Thank you. So Berkshire Healthcare CAMs offer quite a wide range of services for children and young people in Bracknell Forest. So we have a number of locality-based services that within the Thrive framework we would describe as providing access, advice and support and getting help. And then we have a number of county-wide services, which are the more specialist services, which again under the Thrive framework would be described as getting more help, getting risk support and targeted services that run on a more county-wide basis. And those services work slightly differently in that our locality-based services work really closely in and with schools, with local authority early help hubs, children's centres, primary care networks, and in the community. Whereas our more specialist services tend to be working more closely with our acute partners, emergency services, and kind of children's social care. And our CAM service in Berkshire Healthcare was set up kind of 12, 13 years or so ago with a single point of access for referrals, CAMS CPE, that probably most of you are aware of. And at that time, the vast majority of referrals were for the very highly specialist services and were coming through primary care. However, with the ambition to transform services and improve access for children and young people, and as new services have developed and in line with the Thrive framework, as Ali says, what we've been working to implement is the principle of a no wrong door approach to make it much easier for children and young people to access mental health services, and to really get out there the message that young people can access services themselves, parents and carers can refer in, our colleagues in education can refer, and really what we want is the person who knows that young person and what's going on in their lives to be able to support them to access the right help and the right services. Could you just go back a slide again, Louise? Thank you. That'd be really helpful. Thank you. What I wanted to point out on this particular slide is that one of the challenges that we've had in the CAMS sphere is that there hasn't been really a clear definition of help and any kind of clear definitions on waiting. And so we've been really struggling to determine what waiting looks like for CAMS. NHS England have very helpfully now created a really clear definition of help, what help means in that mental health sphere, following some pilot work and lots of feedback from children and young people and kind of that wider range of professionals. And they've identified a number of metrics that relate to stopping the clock for waiting times. They've not yet implemented any kind of performance or management targets. However, they are monitoring a number of metrics, and in particular, the number of the percentage of children and young people who are receiving help, where we're able to demonstrate that we're delivering all the elements of what would stop the clock within 4 weeks. They're also looking at the median wait time and then the 90th percentile wait to show those longer waiters. And so we've been working really very, very hard to ensure that we're able to capture and report on waiting in line with those NHS England definitions. And that's some of the data that we're presenting to you today. Reducing waiting times is a breakthrough objective for the Trust, and CAMS are one of the areas of service where there is being particularly prioritised for support around this. So it's what we describe as a driver metric for service, and all of the CAMHS teams who are contributing to long waiting times have quality improvement work going on in those teams to try and reduce waiting times. And I would also note that we're having to do some work to transform our clinical record system to ensure that we're able to record all of the different metrics that are necessary to stop the clock. So that's not just about a young person receiving an appointment, but it's about there being an agreed care plan with that young person, there being some outcome measures and some experience measures as well. So, you know, very, very focused on ensuring that when we're stopping a clock, it's because a young person is genuinely receiving meaningful help at that point. If you could take me to the next slide, please, that'd be really helpful. Thank you. So we've been working quite hard over the last few years, as Ali has said, to develop the early help pathway for emotional health and wellbeing. And our hope in doing that is that we would be able to stem the flow of referrals to the more specialist services in order to ensure that young people were getting help earlier. So around about sort of 40, 48, 49, 50% of referrals to our front door were referrals that really could have been supported at an earlier level, didn't necessarily need those specialist CAMHS services. And so what this graph shows is that we've been really successful in reducing the number of referrals to our specialist services. And the percentage of referrals now that are coming through to our front door that we are directing back out to earlier help services has correspondingly reduced, which is a really, really positive impact of the good work we've been doing on that early help pathway. If I could have the next slide, please. So what this table shows is a little bit about the current waiting times by CAMHS team. At the moment, our clinical record system is only, we're only able to see that wait time to the first point of help. The transformation work that we're doing with the record system is actually going to enable us to be able to track the whole patient journey. So we will be able to see whether or not any bottlenecks are developing within a care pathway, and to enable us to then take immediate action to address that. But at the moment, what we're monitoring is that wait to kind of first contact, which is meaningful help, and then trying to track second contact at the moment as well. The new RIO transformation programme, which is our clinical record system programme, will be rolled out to all teams by the end of 24-25. So we should then be able to get a full year's worth of data next year, and that will be really helpful in terms of seeing where we might have some kind of further problems. So what you'll see is that there are quite significant differences in waiting time across various different services. So children and young people's eating disorder services, for example, were set up with a national target for urgent referrals to be seen within a week and routine referrals to be seen within 4 weeks, and they were resourced to be able to achieve those targets, and we consistently achieve those targets. Our early intervention in psychosis service similarly has targets, and young people are seen very, very quickly. Our targeted services were able to see young people very, very quickly in those services as well. And our crisis service, obviously, we see people usually within the same day, and if they're presenting to emergency services, it's within 4 hours. But there are some differences, and what you'll notice particularly is that there are longer waits in the getting help service, which are the early help part of the pathway. And that might look concerning, but actually it's part of an improvement journey. So previously, quite a high proportion of those young people would have been going into CPE because they were low priority in terms of not presenting with high levels of risk. They were often sitting and waiting for quite a long period of time in that CAMHS common point of entry before being sent to the right getting help service. They're now going to the getting help service in the first instance, so they've got one wait rather than two. And although that looks longer, it is actually quite a significant improvement on how long those young people were previously waiting, and is still an improving picture. For Bracknell Forest, our getting help teams are a top contributor to long waiting times. And as I've said, really the reason for that is partly positive because we have been working hard to increase referrals. It's also partly due to workforce challenges. And we've got quite a lot of quality improvement work going on to address that and to reduce waiting times further. If I could have the next slide, please. I'm going to skip over this slide and just kind of move to the next slide, if that's okay, because it gives very similar data. So this is just basically showing you what the waiting time picture has looked like for Bracknell Forest over the last 12 months. So it shows you what the average wait in weeks was across all services to that first appointment, which is the meaningful help appointment. The next graph shows you the percentage of young people that are being seen and receiving that meaningful help within 4 weeks. That percentage figure is underrepresentative because until recently, NHS England hadn't given a clear code for advice and consultation, which is one of the activities that would stop the clock. And so in some of our specialist targeted services, such as children in care, or the link team, which works with children and young people with really complex needs, actually we work through other people who know and are involved in the lives of that young person. So rather than introducing a new person into their life, we may well be working through the social worker, or we may well be working through parents. So we are teaching and supporting them to deliver the intervention to the young person. And that activity is something that we haven't been able to capture until recently. So that figure will be increasing, which is going to be really positive to be able to see. The next one shows you the kind of median weight, and then the kind of 90th percentile weight. And what you'll be able to see is that there's an improvement being shown in all of those different metrics, specifically for Bracknell Forest, which is really positive. Our mental health support teams and the getting help teams, as I've said, are top contributors to longer waits than we would like to see. And they've been using our trust quality improvement management system, which uses lean methodology and tools to address their challenges around waiting times. So they've implemented improvement actions, for example, the ability to pre-book assessment slots for new patients, very proactive work around filling clinical vacancies. The recruitment picture in CAM services has been a real challenge over the last few years, but has improved quite considerably over the last 12 months. We've done quite a lot of work focused on really understanding what makes clinicians want to work and want to stay with us. So a real focus on kind of well-being and joy in work to try and ensure that we're maintaining and developing our clinical staff so that we can continue to provide care for our local population. And we've also done some work around, for example, appointments that weren't attended, because that was identified as a root cause in terms of some of our long waits in some of our Bracknell cases. And if I can have the next slide, please, which I think is my last slide. Just to give you a bit of a flavour of kind of service user experience. So alongside waiting times, we also look at service user experience and outcomes. We use 2 measures of experience. We use a national tool called the Experience of Service Questionnaire, which has a child version and a parent version. And we use that at the end of an episode of care, and data from that tool flows to the National Child Outcomes Research Consortium. So we're able to see national comparison, and that Experience of Service Questionnaire also links to the national NHSE guidance on what stops a clock in terms of a young person having received meaningful help. And then as a trust, we have a tool that we use, which is called I Want Great Care, and feedback can be given at any point in a young person's journey. So that provides young people and their parents and carers with the ability to provide that kind of immediate feedback whether things are good or not so good, and so we can take action to address things in the moment, and enables some comparison across trust services. And we monitor feedback through our quality improvement huddles that take place weekly in all of our teams. And we bring children and young people's feedback into that quality improvement work, and we work with young health champions and provide feedback in terms of, you said we did, to children, young people and their families as to the feedback they provide us. And broadly speaking, our performance data is good. And you can see from that 93% give us a really positive score. We have quite a low percentage of negative scores, and our overall rating is 4.75 on a 5-star score. And then the score by question is, again, you can see the kind of really positive feedback that we get from children and young people once they get into our services. And I think that's my last slide, Louise.
Thank you very much. Yeah, we're moving on to dentistry.
Yeah, brilliant. Thank you very much, Chair. Thank you. So included prior to the meeting was a report that hopefully picks out some of the key points that you're interested in, but I'll pull out some of the bits that I wanted to highlight particularly. So obviously we are very aware of the public concern, particularly about access to dentistry at the moment, and so view this as being a key priority for work for us. If we look at numbers in terms of how access to dentistry locally has improved since the pandemic, then Frimley has done well in comparison to other areas in terms of number of patients accessing a dentist now in comparison to pre-pandemic. And included in the report again is a figure of kind of 83% of people reporting the ability to get a dentist appointment when they needed one in the 3-month period up to the end of March 24, which is the latest data we have. However, recognise that there is a need for improvement. So in November we approved some additional schemes with funding attached to try and improve access. And again, as I'm sure you're all aware, there's the national drive for an additional 700,000 urgent appointments next year, of which our share is around 6,600. So one of the key services that we've put in place since November, but which will be expanded to help us achieve improved access, and our share of that 700,000 is our additional hours scheme. So that's all already approved to deliver around 4,000 additional appointments, and that covers urgent need and then the ongoing treatment and stabilisation required to deal with whatever issue it was that caused that urgent need. In Bracknell specifically, then again included in the pack, there's a kind of a map of where our contractors are. There's a reasonable geographical spread, and in terms of delivery of the activity that they're contracted to do, then that's fairly good. So more than 95% of what we ask. Obviously, what we're looking for is how we can kind of expand that ask. And so there will be a number of initiatives early next year, things like rebasing of contracts and also procurement of additional units of dental activity to try and improve that access. And additionally, we'll be offering something which again has been a national scheme, but we'll be offering locally next year Golden Hellos to encourage new dentists to come and work within the Frimley area. The other thing that we really want to do is work with public health colleagues on prevention initiatives as well. And so that's something that our team have been working on and making contact with colleagues with local authorities to develop our work in that area. Yeah, I will pause there because I know we wanted time for questions.
Okay, thank you very much. Thank you to all of you for your presentations. That's really helpful. So we'll open up for questions. I think we've had all of the presentations, haven't we? Yeah. So we'll open up for questions. Yes, okay. Councillor Eggleston.
Thank you, Chair. Can I just check, are we allowed to ask a question per category or just one question?
Yes, ask what you like.
Oh, perfect. Thank you. So first of all, to dentistry. Well, thank you all. Excellent presentations. Dentistry first. What about the dentistry for SEND children and adults? What's the data on that at the moment?
Yeah, so that there is, we have a contract in place with a local provider, and that contract is actually due for reprocurement in the next couple of years. So we have been working closely with that provider to ensure that it's kind of meeting quality standards and meeting the specification that we've got in place. There's quality improvement projects in place that provider is commissioned jointly with Bob ICB. I don't have the data to hand in terms of numbers, but I can obtain that for you if that will be helpful.
Yes, that'd be wonderful. Thank you. Just so we can make sure everyone is represented when it comes to dentistry. Thank you on that. My next question is for the CAMS team. When you say, first of all, that they go along for their first appointment, that's their meaningful one, is that an assessment or are they actually starting to receive some sort of treatment at that stage?
Do you want to take that, Louise?
Yeah, oh, thanks, Ali. It varies. So what's been really helpful in terms of the NHS England definition is that they have really identified clearly what constitutes help. So it can be different things for different people. So it could be that a young person is referred in, or their parents or carers or the young person themselves seek contact, and there is a discussion with them and with a skilled CAMS practitioner to understand what their needs and difficulties are, what they want to be different in their lives, and to think with them about what support might be the right support. And it could well be that that support is not mental health support. It might well be a youth worker, or it might well be support in terms of accessing particular type of activity outside of school or outside of the family. But it's agreed with them that that is what is going to make a difference. It could be that the contact is with a social worker or a family member or a teacher at school, and that actually what the CAMS practitioner does is work with that individual to support the young person to meet their needs and difficulties. It could be that actually what happens at that first appointment is there is that initial piece of assessment work, and it's identified that a particular type of treatment would be helpful, and that treatment will begin in that first contact. So it's a range of different things, but what's important is that they are agreed with the young person, and we need to demonstrate that there is some kind of positive impact and outcome for that young person as a result of that first contact.
Right, excellent, thank you. And do you think like sometimes the wait can lead to the DNAs?
Sorry, just to check, do I think that sometimes waiting is what leads to people not attending appointments?
Yes, that's right.
Yeah, I mean, I think that data tends to suggest that people potentially will not attend appointments if they've had to wait a long time for them. When we look at, we don't tend to talk about DNAs. We tend to think about things in terms of kind of was not brought when we're talking about children and young people, because it's not always the young person that's kind of in charge of whether or not they're able to attend. And one of the things that we do is look at what are the root causes kind of underlying why people don't attend appointments. waiting doesn't tend to come up as a particularly top contributor. It tends to more be things like, are people are being offered appointments at times that kind of work for them? And it can sometimes be things like, do they understand what the purpose of the appointment is? And so really we want to understand the root causes to be able to kind of address the problem.
Thank you. And can I just ask one question to the
Sorry, Councillor Eggleston,
the
I think Alison has something to add to that.
I just also
thank
wanted to add, Councillor Eggleston, that it'll have been in the detailed paper, more detailed paper that was shared with the panel, but there's been quite a lot of work that's also gone in to what support can be offered to young people who are on a variety of wait lists actually across health services, not just our CAM services. And I think, you know, that additional support going into young people who are waiting, I think helps keep them where they need to be safely before they get to the top of the list. And I think we've evidenced that quite well across a range of services, and I think it is again having a positive impact. So I just wanted to add on to what Louise was talking about.
Lovely, thank you. And can I just ask one more question for the PCN? Is that all right, Chair?
Certainly is.
Thank you. So my question to the PCN is, well done, first of all, for all that you're doing. And secondly, for being able to come along and present in the middle of QOF, because I know you're obviously trying to get everything pushed through at the moment before the end of March. But my question lies with, how are you finding it with the delays when you do referrals at the moment? Do you find a lot of the patients are coming back and taking up more time, and how are you combating that?
Thank you, Councillor Eggleston. That's a really, really interesting question. So you're probably aware that we obviously have our individual GP practices, and we have primary care networks. We've got 3 within Bracknell Forest. So we've got the one that I'm involved in, which is Bracknell District PCN, which has 4 GP surgeries involved. We've got Forest Health Group, which are the Bracken PCN, and then our 3rd PCN involves Ringmead and 2 other practices, which is the Health Triangle PCN. So we come together and work at scale where it makes sense to do so, such as with our COVID and flu vaccination programs, for example. In terms of what we're trying to do, I mentioned that slide earlier, in particular where we had the pink central element of it, where we're trying to get the reactive care to proactive care. So what we're trying to do at the moment with our patient models and segmentation is to try and look at our patient groups, and during the April to September, October months, do a lot more of our proactive work and what you described as our QOF work. So for example, we would look at patients with long-term conditions, whether that would be respiratory conditions, cardiovascular conditions, or in fact what we're finding with an aging population is multiple conditions. And we would try and get their yearly reviews perhaps earlier in the year, so that if we've optimized somebody who's got a breathing difficulty, whether it's asthma, COPD or other, earlier in the year, by the time we then get to the winter months, we would hope that they have less exacerbations of that condition and therefore need less of the urgent care type models. Yeah. So trying to do that work in a slightly different way, but using data and using digital and using all the information that over time is getting easier to access, we're finding it's having a positive benefit on patients. And the second aspect of your query on there about waiting lists. So some of the work I do is looking at clinical interface committees, so looking at the interface between primary care, general practice and secondary care, our acute hospital trust. So obviously from a Frimley perspective, we know that they are working incredibly hard to get those waiting lists down across all aspects on there. But of course, if we have patients on waiting lists, their condition doesn't go away. So it does mean that they will consult with general practice while they're on those waiting lists. So absolutely, it does mean that we are seeing them more frequently for those conditions. So say the patient that's got arthritis, that's waiting for something like a joint replacement, they still have an ongoing healthcare need while they're on that waiting list. And it does mean that they consult more frequently while they're waiting for that definitive appointment with the specialist. So absolutely right, that has taken some of our capacity and means that our capacity elsewhere has probably been slightly more limited.
Lovely. Thank you ever so much, all of you, for all of your responses. Thank you.
Thank you. So I have some questions, and then I'll open up to other colleagues in the room. So staying with you, Annabelle, Dr. Buxton. So as a mum of 2 small children, I feel like I'm ringing the GP every week for one reason or another.
You're not alone, don't worry.
Yeah, indeed, along with everybody else. And so I certainly, that sort of call back in the queue, hold your place in the queue thing is a godsend at school run time, I can tell you. But I don't personally use the kind of digital door that you described. And so for me, it feels if you ring at 8:01, 8:02, you're still not going to be seen today. And I've also got the experience of the fantastic new practice in Binfield, which I've been pleased to visit both as a resident and as a ward counsellor. Has the number of doctors, does that now match, or does that now more closely match the number of all the new rooms in the practice? Because I think that's where perhaps the tension still lies in getting appointments, is that we've got all these lovely new rooms in a great practice, but not the number of doctors to match it.
Absolutely. So it is incredibly tricky in terms of how funding streams work from NHS England currently, and what practices can afford in terms of further employing staff. We know that particular practice is recruiting for planned retirements, and they have appropriately backfilled those appointments from there. In terms of most practices, we as I said do suggest for patients under 14 and under using the Healthier Together website on the Frimley aspect of things, and also the Healthier Together app. So that has really good data behind it, has a paediatrician and clinical lead looking at all the algorithms that sit there, and our Frimley patients and parents really like the fact that they can rely on, once they've been through any concerns they've got about their children, it will give them an outcome that is either self-care or it will direct them through to their surgery, enable particularly parents of younger children to be able to access appointments easier if they need them. And in terms of Binfield, obviously we have that joint space, so we have 2 consulting rooms outside of the main surgery, and then we've got the consulting rooms within the surgery itself, but obviously they do act as their own independent business.
Thank you. I know David wants to add something.
Yes, just wanted to pick up on the staffing element. So as Annabelle highlighted there, one of the challenges our practices are independent businesses, but actually what would be helpful and where we could use help in communicating with patients, general practice is more than just GPs. So through NHS England, there's the additional roles and reimbursement scheme. Some of my colleagues have spoken about that, because that includes mental health workers, it includes paramedics, it includes nurses, clinical pharmacists. So once again, depending on what the clinical need is after a patient is triaged, they might be seen by any of the team. And I think being able to highlight that general practice is wider than just the GP and just the nurse is a helpful message to remind people that they will be directed to whoever's the most appropriate clinician.
Thank you very much. And I have a question on CAMS, or on mental health in young people. So the number of children with mental health issues is rising. We've seen there's I would say an obvious link with the COVID, with the pandemic, with the lockdown, and the impact that would have on a certain age group that were going through that at a certain time. I mean, if that trend continues, then there are going to be other factors playing into that as well. Moving on from the pandemic, what do you think is the impact of social media in that rising graph. Where does social media bit fit into what you're doing? Is that a different government department? And how do you link all that up? Because I certainly, I'm not an expert, but I would bet quite a lot that social media has a lot to do with that rising chart. And once we're well past COVID, it will still have a huge impact. I can't see whose hand's up, but go ahead.
Yeah, thank you. So if I start, and I know my colleagues will be able to add to this, and we are very much aware at the impact that social media has on children and young people, and adults actually. And I think there is a huge amount that's happening across the system. And we rely very heavily on our schools, working in partnership with our schools to really make sure that children are in environments growing up where they feel safe, that they can report any issues around social media bullying, cyberbullying, all of those things that those of us who have children, very few parents at the moment will have not had that experience of a child coming home from school or university to say that they've had a negative experience on social media. For the ICB and for our whole system, one of the things that we often do is talk to children and young people and bring their views in to help shape the services that we create. So actually the voice of children and young people in all of the work that Louise and Ali have talked about is absolutely imperative, and that's where we get that really important information to help shape the service and the support that's offered. I'm going to hand over to Ali, but I know also that Louise will be able to talk about the trauma-informed approach that all of those services take, because there's such a long-lasting impact on children who've had those negative experiences and have been influenced by social media, particularly around their mental health. And we know that there are some dangerous websites and access to a whole range of really awful information for children and young people shouldn't be seeing that. So that trauma-informed approach that Louise and her team really deliver their services based on is really important. But let me hand over to Ali and then we'll move over to Louise. But thank you for raising that, because it's such an important part of our work.
I've now got my speaker on, so you'll be able to hear what I'm actually saying. So it's a really good question, Chair, and it's been raised at other scrutiny panels in our other local areas as well. And, I think it's an area of concern for everybody. I think, and Louise will talk more about it, but I think the principles, the Thrive principles and the strengths-led model that we're trying to implement in all of our services is going some way to really enabling our children and young people to become their own agents, really, and self-manage. That's difficult and it's a challenge, but it's part of that education that we need to be giving our children and young people, because social media isn't going away. It is with us, and there are other things coming along like AI, for example, that's with us already. And I think it's just equipping and empowering our children, and that is coming through the model, the Thrive model, and Louise will talk a little bit about that as well. I'll hand over to Louise to see if she's got any final comments.
Yeah, thank you. I mean, there probably isn't a great deal more to say that you haven't already said, but I think that one thing that's useful to just pick up on is the way that we work collaboratively with children and young people themselves in terms of kind of young health champions, really, and trying to understand what they're seeing as the major impacts and what they think will help to counter those challenges. So the trauma-informed way that we work that Tracy's talked about is very much looking at what's going on for that young person and what are the factors that are affecting their emotional well-being and how they're feeling about themselves, and really trying to kind of take all of that into consideration in terms of thinking about how we might need to work with them and work with them and support them. our mental health support teams in schools work very collaboratively with schools around that kind of whole school thinking, and what needs to be put in place within a school system to help and support a young person, and certainly social media, just thinking about the impact of social media, and how accessible that is in schools, and how we can work with young people to help them to manage the kind of impact and understand and move away from social media where it's possible to do so, is very much a kind of part of the way that we work, really. But it is a challenge. Yeah.
And thank you. And for obvious reasons, you're there to help people once there is an issue. And is that, I suppose, part of my question about the joint up? Are you feeding back to which other bit of government there is to say, this is the data we're getting, this is the impact it's having, so that actually it's not reactive, it's proactive? And if AI or filtering or whatever is increasing the amount of eating disorders or whatever, that we're not just there, you're not just there having to deal with the mess, that we're addressing it before.
Yeah, so we feed back through the kind of regional networks the impact that we're seeing, and through that route up to central government.
Thank you. Any questions? Councillor Watts.
Hi, firstly, I'd just like to say thank you for everything that you guys do. I mean, obviously, I have 4 children. They dip in and out of Frimley now and again, especially the CAM services. All of my children have used CAM services and they've been treated very, very well. So thank you. I can only imagine it's a stressful job. But following on from what Georgia said about combating mental health in young children, I mean, if you have it, obviously not right now, but if you have it, I'd be interested in seeing any numbers that you have on the factors that affect this.
And some data on the factors that impact on the development of mental health difficulties. Is that what you mean? Sorry.
Yeah, things that are basically increasing the problems with mental health in young children. As obviously we have social media, but if you had any data on it, I'd be interested to see.
Okay. Yeah, that's fine. There is some research that we can share.
Yeah, I suppose linked to that, what is the biggest issue, driving that, as Jodie said? Are there other things that you can pick out?
The data on this is really quite limited, actually, but one of the factors that there is some growing evidence around is loneliness, which we know is a factor in adults, but seems to have become more of a factor in children, and impacted by COVID and the pandemic, and the way that children were, that their access to school and friendship groups and things were limited, and social media and that kind of way that they live in that digital space. And certainly that one of the pieces of research is indicating that the generation of young people that we have now are maintaining less contact with their friendship groups than previous generations have done. And the surveys with children and young people themselves are indicating that as being one of the factors driving things forward as well. But the kind of research around the to demonstrate what actually what the genuine kind of drivers are is still quite limited. So there's lots of ideas, lots of sort of thoughts about what the factors might be, but not much of it yet has been kind of evidenced constructively.
Thank you. Councillor Eberle, then Councillor Webb.
Yeah. First of all, thank you really very, very much for what you're doing. I really liked the presentation, very informative. Albeit a bit heavy on acronyms, to be honest. So I didn't really catch everything what you were talking about because it was simply a bit hidden behind the acronyms. One question which I have regarding the last slide which you had about the user rating for the child services, if I paraphrase it correctly. The user rating is actually really good. Congratulations. But what happens to these 5% which are not satisfied with the services? What is your follow-up program to reach out to these children in need?
So we've got 2 different tools. With the experience of service questionnaire, because we give that to children and young people at the end of an intervention, we're able to track back and see who's giving that feedback. And so if they are expressing dissatisfaction, and of course that's not the only way that we kind of capture that data, so we talk with them in their individual sessions, and we use things like goal-based outcome tools and session rating scales and things like that. But we are able to connect with those children and young people individually, to really think with them about what could be better for them and how could we work differently. With the I Want Great Care, that's anonymous. And it's quite important that we have some anonymous tools, because some people feel it's really, that's the best way they can provide feedback. But we use the You Said We Did methodology in terms of in our waiting rooms and the way that we communicate back out with parent carer forums and our service user groups, so that we take the feedback and we look at what's that telling us and what do we need to do differently about it.
Okay, no, thank you. Am I permitted a second question? Thank you, Chair. What is the opinion of new specialists about the experiment which Australia has started of basically forbidding smartphones for children of up to 16 in schools? What's your thoughts about that? I think it's very recent. It's half a year old, this measure, and I do not believe they have any data collected yet. But
no.
I presume you're keeping an eye on that and will adopt whatever comes out of that.
And we don't have any control over what education what decisions are made by the Department for Education and by individual schools. But yes, very, very interested to see the outcome of that policy in Australia. And obviously we've got some schools within the UK that are kind of making that decision as well. So it'd be really, really, really keen to see the impact of that.
Thank you.
Thank you very much.
Councillor Webb for the last question, then we'll wrap this up. Thank you.
Yeah, it's on, isn't it? Thank you, Chair. Thank you very much for coming along this evening and giving your presentations. They were excellent. My first question is about primary care, so I guess it'll be Annabelle, if she's there. It's a question and a concern, really. I noted last week when I contacted my doctor's surgery that I was able to access the pharmacy online by having a video conversation, which didn't work for me that time, which resulted in me eventually, by calling 111, going with a referral to the local pharmacy who was a prescriber. And my concern is that when I got there, I did get what I needed, but I felt that the pharmacy was very overstretched and there were people queuing out the door waiting for referrals. Are there any plans to, I know it's new at the moment, this new service, but to straighten out all the difficulties, and will pharmacists be getting any help? Because she didn't actually have my referral, she didn't have the IT, or her PC wasn't set up. Are there any plans to help pharmacists with this new way of directing patients to get medication? Thank you.
Thank you. I think it's a really interesting reflection. Obviously, I look after more the general practice element. I think Tim is here looking after the pharmacy element. So if I can hand that one over to Tim, I'd be grateful.
Yeah, I'm happy to come in on that. So, there is. So really interesting to hear that experience, and thank you for that. I would be keen, if possible, outside to hear about the particular pharmacy, because there is quite a lot of support available. To slightly contradict that, or to add the context to that, we do know that pharmacies are under a lot of pressure at the moment. There is a national contract negotiation happening, but that has been going on for a long time. And so the financial situation for a lot of pharmacies is challenging. So they are finding it difficult to invest in additional staff. However, like I say, there is support out there, and I can certainly signpost that particular pharmacy and get people supporting that particular pharmacy. The Pharmacy First service, is a real opportunity as well for pharmacy. So if we, and obviously as well for local people, if we can get it right and get the pharmacies having the right process and the right staffing in place, it is a huge jump forward in terms of the future of pharmacy. So it will be new roles that will attract new staff to a kind of more exciting role within these pharmacies. It will be a new funding stream for them, which will hopefully make them more resilient and able to expand into other services in the future. So yeah, anything we can do to support local pharmacies to get those services right, then we're very happy to do. We have a number of people within the team that can support pharmacies with that.
Okay, thank you. I have another question, if that's possible.
I just wanted to add to Tim's response,
yes.
And just to highlight that actually in terms of working together and support, if when we do hear feedback, you can provide it and encourage people to provide it back to practices, because that way we can close the loop in understanding what hasn't worked and where things can improve, because if it is just something of an IT system, the more we hear about it, the more it enables us to do something about it. So I think if you do get feedback, we'd always be very keen to hear it and to share it with practices, both general practices and pharmacies.
I'm happy to provide feedback. I do have one more question, and it's a CAMS question, and I think it's not a very long question. When you have your first appointment, a referral, how long would it take to be referred to a specialist team?
There isn't a sort of straight answer to that. It depends on the needs of the individual young person. So for some of our services, there is direct access to that specialist team. So for example, if you're a child in care, if you're a child with a learning disability, or your referral is to one of the complex services, you're actually straight with that specialist team. If you present through a school, then you would be seen by a mental health practitioner within the school. So again, you're sort of straight with that specialist team. So if you come in through the common point of entry, it can take a few weeks for you to. They will do that kind of initial assessment piece with you to work out what your needs and difficulties are and kind of where you might need to be going to receive support, and there can then be a few weeks. But it's the data that we've given in the pack in terms of the waiting times gives you the waiting times to the various different teams.
Okay, thank you.
Thank you very much. I think we'll conclude this item now, as we have given it a very significant amount of time, but rightly so. I think thank you very much for your presentations and for your fulsome answers. And we will move on to the recommendations section. So would anybody like to speak in the debate about any of the issues we've discussed now? No, well, I mean, something I have certainly, I think we're probably all struck by the word loneliness, in the fact that that's a huge contributing factor to children in this sort of super connected day and age. I suppose I would like to suggest a recommendation that we would ask the Cabinet whether it's working with partners in Frimley ICB or finding out more from partners in Frimley ICB more about this, and look at ways that this could be tackled and addressed at source. What can we do in our community to make sure that children aren't lonely? Good.
Sorry, if I may. There's just one experience which I would like to relate. When we did a ride-along with the Thames Valley Police, we ended up at Crowthorne at the Morgan Red. Basically, winter, night, it was raining. Yes, it was really quite bad, dire, but still there were a group of teenagers there. And basically were just munching chips. They were completely harmless and nice and well brought up kids. And we asked them, well, why are you here? They said, well, there's nowhere else to go. And this is actually quite concerning, because there's no cafe, no youth club, nothing which is really accessible to kids of an age range of between, say, 12 and 16, where they could hang out, say, until 10 o'clock at night under, say, a moderate supervision in a context which is not out in the wild, basically, because out there they're exposed not necessarily to the worst kind of predators, but also basically to people who want to sell them drugs or whatever. So what can the council do to improve the situation? Can we attract more businesses which are targeted at youth in this age bracket? Is there a possibility of establishing some sort of youth clubs locally, which can be accessed youth workers? I think that would be my question on my contribution to that. Sorry for talking at length. Thank you.
Okay, thank you. Shall we, Lou, have you got that? Do you want to work that up into a recommendation? And then we'll ask for a seconder.
So the first one, I think the recommendation is for Cabinet to work with NHS Frimley and Berkshire Healthcare Foundation Trust Partners to look at what is behind loneliness and for young children, for children and young people, and address its source.
Yeah, I think find out more about, for certainly the Cabinet to find out more about that, and then discuss how we can make sure that doesn't continue.
And ways to address it then. Okay.
Are you seconding that?
Yes, I am, Chair.
Okay. And the second one, Councillor Everly, you may have to help me with, but something about looking at encourage the Cabinet to look at opportunities to encourage children and young people, or opportunities for children and young people to socialise. Okay.
Socializations opportunities.
Okay, can we have a seconder? Councillor Presslin, thank you. Okay. Councillor McLean.
Thank you. I was going to pick up on the fact that a number of the speakers tonight have made reference to the importance of data in developing positive outcomes. I think what I would recommend for the Cabinet is to see if there's anything that Bracknell Forest can do in order to ensure that the data that we have and the data that other health providers have is managed effectively and delivered to the right place to help deliver those outcomes.
Somebody like to second that? Councillor Watts? So online, Councillor Eggleston, then Mackenzie Boyle. Unmute.
Apologies. Thank you, Chair. So my recommendations are around the pharmacy first. As we know, it's aimed to finish the review by the end of October. I think as a council, we could help with the help of Frimley to sort of really promote that. We know that there's 7 particular ailments that the public could go to the pharmacy first before even going to the GP practice, which would then obviously take some pressure off of the practice. So I would first of all like to see us work with them, and also I'd like the PCNs to be able to log better rather than ringing up and being referred, sometimes just verbally, to actually use the button on EMIS so it's actually registered, so there is proper data to say what time, how many has been saved, etc. on time and referrals. Thank you.
We got a bit lost in the acronyms there. PCN, EMIS, don't know what they are. Sorry.
So EMIS is what's used in a doctor's surgery, and sometimes you can call up and somebody can just say, have you been to the pharmacy first? And there's no real record of that to sort of say, someone's phoned in, that's where they've been referred to. Whereas you can actually log it, so then the GP practices can then report back to say, actually, we didn't have to see 20 people, they went to the pharmacy. And it's just sort of highlighting, and I believe the council could sort of help them with that as well.
Okay, I think both Annabelle and David have put their hands up, so they might have something to contribute there.
Yeah, I can go second, honestly, if it's part of what Caroline is saying.
Go ahead, David.
Oh, go on, Annabelle.
So it was just to say, if we have through our digital system a patient that comes through with a condition, because we've all got these laminated on our desk, that is suitable for Pharmacy First, then on the EMIS, which is our clinical system that we record patient notes, we have a local referral system on there. So we click the local referral and it will take, based on the patient's postcode, it will give us the nearest pharmacy based to that patient, and we create a referral and we save that in the patient record, and then we would contact the patient and say, you have been referred, the pharmacy should contact you, but just in case, please give them a call if you don't hear. So Tim again and Yinka, the pharmacy lead, will have more details on there, but it enables us to look at the number of referrals that we've made from general practice. And we can then also look at the quality of the referrals that have gone through, any that have bounced back, which may be because they don't fit, or the commonest reason that any get bounced back, other they don't fit the criteria. And this is quite new to all of us, so it is something we're all learning. And obviously all pharmacists have got their own pressures, and their training, is taking place along the way as well. So in general, we are collating really good data in terms of Pharmacy First. And Tim, you can probably expand. There's some Pharmacy First sort of plus groups as well, aren't they, in terms of additional work that's going on.
I think we're reassured that it does sound like you are capturing what Councillor Eggleston said, unless you feel otherwise, Councillor Eggleston.
No, I just wondered if it was uniform across all of the GP practices that we have in the borough. Is that something that can be confirmed? Because obviously Waterfield are doing a brilliant job capturing everything. It's just, is that uniform across all the GP practices?
Okay, Tim.
Thank you. Yeah. So certainly in the early implementation of Pharmacy First, and there definitely was some variation in terms of how the referrals were undertaken. So sometimes it was people being told you can just go to your pharmacy with that, rather than necessarily an electronic referral being done. There has been quite a lot of training and information dissemination to try and ensure that the referrals are done properly electronically. I can have as Annabelle says, do have a lot of data on that. I can follow up with Yinka, our lead in this area, just to confirm around referral rates and whether there still is any variation between practices.
Okay, thank you very much.
Thank you.
Councillor Mackenzie Boyle.
Thank you very much, Chair. And through you, I thank Councillor Earbley coming to visit Crowthorne. It's very kind of you to pick up on something like that. But as a councillor for Crowthorne for over 20 years, we have tried every which way to encourage our local children and those that slip out of the group, if you like, from the 12 to 14, 16. On a number of occasions, we provided the jack just around the corner. In the buses, we had a group that met at the Baptist church. But there comes a time when you have the open doors and nobody comes in. So I would like the part of the recommendation to encourage the Cabinet to come into Crowthorne, to come to talk to the councillors who've been there for many years, to say what failed and what we think will now be a success. We can't ignore this very, very vulnerable group. So thank you, Councillor Earbley, for picking that up.
Are you still happy to second that? Slightly amended. I can't remember who was seconding. Councillor Presland, yes.
Sorry, Chair, is that a change to Councillor Eberle's, or did you want it broader than just Crowthorne? I don't know what.
Well, I don't quite know if we have, forgive me, Tina, have we captured what you wanted to say in the original proposal? Maybe you want to read it out again?
Yeah, if we could just expand on what you said to say, let the cabinet come in to see what failed and what we think will succeed in the future for those who have been there for many years, because we don't want to waste time.
Yeah, I think that's a good point, because if they sit around a table and come up with ideas that you've already tried, then yeah,
absolutely.
Thank you.
Yeah, thank you,
Councillor Webb.
Just a very quick one to go back to my experience with not having a service that was properly implemented, to make sure that there's some channel that's available for people to feed back dissatisfaction with the service, so that things can be improved. That's it.
I'm happy to second that. Have you captured it? No?
Yes, it's how to look at, could the Cabinet look at different ways of capturing dissatisfaction of services? Yeah, do we have a seconder for Councillor Eberle's proposal?
It's Councillor Presland.
Presland, thank you. Just to check.
Thank you. So shall we vote on those together or individually? I'm happy to vote on them together unless anybody feels strongly about an individual one. Okay, so please can we take a vote on the group of recommendations we've just discussed? Thank you. That's passed. So we thank our visitors again for coming and spending so long with us this evening. It really is appreciated, and for your contributions. Thank you very much. And you're free to go.
Thank you.
Thanks all. Bye.
Thank you.
Chair.
Hello.
Hi. May I have 5 minutes, please? I'm just going to escort 10-year-old off the premises to go home. I'll be back in 5. Is that all right?
Absolutely. Minuted. Yeah.
Thank you very much. Thank you.
Okay. We will move to agenda item 7, if you're ready. Great. The Council Plan Overview Report, which we will call the CPOR in the duration. I would like to welcome the Chief Executive, Susan Halliwell, and ask her to present the CPOR, please.
Thank you very much, and good evening, councillors. The report's been shared with you prior to the meeting, so I won't go into a huge amount of detail. I'm mindful of your time. I will just pull out a couple of the key achievements, if I may, of the last quarter, which is across October, November and December of last year. Some examples just to highlight. I mean, we've had health in today, and Chair, you mentioned the Binfield Health and Community Centre. That had its official opening in October, which the council celebrated with partners involved. We also had a very successful campaign for free single bus rides on Thames Valley buses and Reading buses to support the Christmas shoppers, and that was extended to both Saturdays and Sundays. We adopted the economic strategy and the town centre master plans for the eastern and southern gateway in the town centre. And I would also just like to pull out that as of the end of this financial year, we managed to clear the backlog that we had of education and healthcare assessments, and we managed to do that by the end of the calendar year, which was good progress. Challenges still remained, and I mentioned the education and healthcare plans there. We still are finding an increase in costs against the high needs block associated with special educational needs and disabilities, and we were reporting in this report that rise has increased over to 4 million above the approved budget. We are seeing some delays in the Department for Education-led Forest View Academy that's due to be built in Bucklers Park. And we're seeing those continuing issues that we've reported previously around building control, which is a national issue and something we're specifically experiencing locally as well. Just to pull out a positive within the report on our financial position, in that the quarterly report that you will see is obviously from the last quarter, Q3. Just to give you a more up-to-date view on paragraph 5.7, it gives you the range that we're forecasting in terms of potential underspend and overspend when we take into account emerging issues, which is a significantly improved picture than we saw in reports in Q1 and Q2. So we've made good progress there, and we are, even at the end of this month, we're seeing some good progress, particularly within adults, and the costs in there are coming down. I'll leave it at that, if I may, and happy to answer any questions.
Yeah, thank you. Councillor Haverty, let's start there.
Okay, thanks. I've got 4, so I'm just going to put them all together and yeah, all right. Okay, in relation to the delays to the Forest View Academy due to the hold coming from the Department of Education, how is this likely to affect the outcome of our safety valve requirements and timescales? Second one is, I know we talked about street lights and the street lighting issue, dimming issues last month, but if you have it would be good to hear a bit more about these dimming issues. I understand the cost of electricity units per this year, or at the moment, are less than they would have been, so therefore the costs are kind of coming down, but obviously we're still using the same amount of electricity. For climate change purposes, we obviously want to reduce the electricity use, so it'd be good to hear where we stand at, what the issues are. A third one's relating to the free buses and the run-up to Christmas, which were excellent. It'd be nice to know further details about the uptake on that. Have there been any comparisons of this period to the normal use? And if there's only uptake in the bus use after the special deals had finished, so if that'd been going forward. And finally, regarding the HVO fuel trial, I know it's a success, but it'd be nice if we got details of the results from that and what that actually was. And also if you could give an insurance that the ethics of the HVO or fuel is actually good, really, and the source of it are okay, both now and going forward into the future. Thanks.
Lovely, thank you. If I can take the very last point first, yes, that was a consideration in the trial and was considered when we were setting up the pilot. So yes, I can give you that assurance. Of course, it's something that we will always have to be really mindful of as we go forwards. For data around the trial itself and also the bus patronage, I don't have that to hand, but we can certainly pull that together and share that with the committee after the meeting if, Chair, you're happy with that. With regards to Buckler's Park, the Forest View, at Buckler's Park, that is a DfE-led school. We have been chasing to get an understanding from DfE as to where it is in the process. In the meantime, and you mentioned the safety valve programme, it's really important for us to have a plan B. Not just because of the safety valve programme, but because of the children in the borough that need those places. And there is a real drive to make sure that we are creating that capacity within the borough. So we are looking at whether we can pull together interim arrangements whilst we might have this period of uncertainty. So we're looking at doing that. We don't have detailed figures yet as to what that might look like and the impact of any delay that might come through from the DfE at this stage, but we're just working through the options.
Can I just jump in there? When you say you don't have detail on the figures, what might those interim measures be, even if...
Well, so for example, you would introduce the children in phases. So if it's got 100 places, you wouldn't fill the school with 100 places immediately. So you might do small cohorts of 5 and 10. If you are looking at that option, then we would look locally to see if we could create a provision of that scale locally with a view to then transitioning them into the school once it was built. But we would need to get a better handle from the DfE on the actual timescales around delivery to be able to inform that approach. But it means you can then have dedicated places within the borough.
Thank you. Sorry, Adrian. Jump in there.
Sorry. Oh, and the street lighting. So I'm very pleased to say that actually from the street lighting activity that took place has over-delivered on the energy savings. So we've delivered on the carbon savings, but the financial saving itself was based on a more expensive energy tariff. We've negotiated a better energy tariff, so overall we've got a better picture, but against this particular business case, we haven't made the savings because it was costed against a higher cost of energy. So all in all, we've delivered against the climate change ambition for the street lighting target, and we've got a better energy tariff, but this particular line item doesn't tell that full story.
Okay, thanks. I think that sounds good. I think when we get to that stage, the recommendations I think will be good for that report. Thank you.
Councillor McCain.
Thank you. Might I ask if the issue around Forest View has any impact at all on the provision that's intended to be put in place at Warfield?
No.
Thank you. The climate change activities, it says it's proving difficult to source external funding. What's being considered? What has been done to try and raise funding from external sources? Yeah, what else can be considered if it's not working?
On climate change activities?
Yes, yeah, it's listed as the challenge for the external funding.
Yeah, so that was one of the highlights of last night's council meeting around the investment into the climate change activities that was agreed last night, is really a capacity issue within the council to be able... Sorry, I'm going to remove my glasses, peering over them for too long. To have the capacity to lever in that investment. So we know that there are opportunities there, but we need officer capacity to be able to target that. So whether that's grant funding through academic research or funding that may be available through government initiatives, we haven't yet been able to move those forwards. It's obviously part of the climate change strategy that's currently being consulted on and will be making its way through to Cabinet and Council. And so we would look to see that to be addressed in the coming financial year.
Thank you. Councillor Watts.
Yeah, Councillor Haffordge actually asked the question that I was going to ask, and I was pleased to hear your response about a plan B for Forest View. And also, I really appreciated the Saturday and Sunday buses during December. It was very useful. Hopefully we can see that again next year. I was just wondering, you say that plan B is to instate the children in a different placement here if there's going to be a delay. Do you have any idea when we might find out when the delay is and how long it will be? And also, given that many of the children will be, the special needs children don't really do very well in transition, might it not be better to leave them out of placement until the building is ready rather than put them in one place and then change them a few months later?
On that final point, we're really mindful of that, really mindful of that, and it's a really important factor. We would only do it if we think it was good for the individual, for the child, and that we thought that they would be a successful transition. So I think, and Gronya can add more to this, but it's understanding the need of the child is going to be paramount in that process. In terms of any detail, I can't give you any detail at this stage. There's a lot more to work on, but needless to say, we're really lobbying very hard to the DFE to get some clarity around their programme. Gronya, did you want to add to that?
We have the transition team, which has been very successful in the primary to secondary. So I think out of 89 children, only one has had issues in terms of not feeling comfortable in their placements, which is compared to a significant number where there wasn't those transitioning supports. So if we do move children in the future, we'll be considering whether or not it is appropriate with the support of that transition team. So given the really positive inputs we've had in relation to that feedback, that will be part of the process. We're also undertaking a piece of work looking at the school estate to see what is the potential for increasing additional capacity on a range of school sites in line of the government's agenda for increasing inclusive education. So obviously documents are going to come out later this year with what that agenda might look like. And we are expecting that to be a factor for mainstream provision. So we're expecting and planning for an agenda where mainstream education are going to be expected to increase capacity. So we're currently doing that work as well in the background.
Thank you very much, Grania, and thank you both for your hard work.
Councillor Eberle.
Yes, thank you. I submitted a question before the meeting, actually, and I found the answer was incomplete, unfortunately. So fundamentally, I asked whether the deferred maintenance regime, which we're doing, where only essential maintenance is undertaken, will lead to additional damage and cost in the future. So I think it was the Executive Director Place who confirmed that yes, it might trigger additional damage going forward. However, the element of cost was not touched upon. My concern is fundamentally we're robbing Peter to pay Paul, and we are fundamentally setting up our future residents with an increased maintenance bill proportionally to what we could have avoided if we would have undertaken the appropriate maintenance right now. So my recommendation on that fundamentally would be to see a business case for that, to ensure that we are not spending more globally than we should spend. Thank you.
Sorry, I don't know that there was a question there because you received the answer and that was more of a recommendation. So I didn't know if you wanted me to specifically. Well, I wouldn't, as an officer, I wouldn't normally respond to a recommendation. So if there's a specific bit you want me to cover off in terms of a question, I can.
Obviously, I'd be interested in your opinion whether this deferred maintenance carries a significant risk for an increased overall spend in the future, say in 5 or 10 years' time. That was the second part of the question, which I pre-supplied. However, this hasn't been answered at that point.
Thank you, Councillor. Through you, Chair, what I would, in terms of my view, I would say that the Council's budget and budget planning process always carries a degree of risk when you are dealing with such a large and complex organisation, and in particular when you're dealing with such a large, complex suite of property portfolio, asset portfolio. We do have ageing assets, and maintenance will be the continuous challenge. We have agreed as a council last night to invest where we can. We've agreed to invest in energy efficiency saving measures, and we have looked to make additional savings around maintenance where it's appropriate to do so, focusing on essential maintenance so that buildings are safe and an appropriate environment to work in or deliver services from. However, as a complex organisation, we inevitably have to carry that risk over the long term, and we'll have to take a longer term view on how we manage our assets, and that will be drawn through our asset management strategy.
Any questions online? No, not that I can see. Any more questions? Okay, thank you very much. So we'll move over to the debate. Would anybody like to speak or make a recommendation? Councillor Haverty.
Thank you. Yeah, I guess basically the reports that were asked for, or that were mentioned. So if we request for ONS to be sent reports for the HVO trial, including the ongoing ethics for long-term use of it, and also request reports for the bus trials, the success of it and the comparisons between before and after the trials. Thanks.
Councillor Watts?
I'd be happy to second that.
Thank you. Councillor McLean?
Picking up the point that Councillor Watts made, I just wonder whether we ought to make a recommendation to the Cabinet to provide further clarification on the placement of children if the DfE continues to demonstrate a delay in the delivery of the services that will be provided.
Is that seconded? Is that seconded? Councillor Watts, yep. Okay. Councillor Aberley.
Yep. as I said, I would like to make a recommendation, namely that the council is provided with a cost and risk assessment about the deferred maintenance, what to put it into a position where it can decide whether more funds should be put into maintenance to avoid future risk to a residence. Thank you. Financial risk, sorry.
Do we have a seconder? I'm happy to second that. Would anybody else like to speak? Okay, so, Councillor Watts.
Not so much a question, but just a follow-up. In looking into the transition for their children, this is more of a brain thing here, but would they? I think it would be useful to know if they would be SRPs and trying to integrate the children into schools, or will they be a dedicated unit that separates them from the schools and keeps them in their own little group? Because if they are going to be sent to another school, it may not be the best thing to have them integrate with the rest of the school and make friends and put down roots if they're going to be moved on to their own place. Any thoughts?
Yeah, good point. Is that okay, shaped into a recommendation of its own? Yes. Yeah.
Yeah, no, we can, I mean, just wondering if it's sort of is similar to the one that Rob was saying. So something about Cabinet to provide clarification on the places for children if the DfE continues to delay the school, including how those children will be.
I think, if I may, I think what we're seeking is reassurance that any steps taken to manage the process until the school can deliver services to the children that require it will put the interest of the child first, which I'm sure they will, but I think we're just looking for that reassurance.
Thank you.
Is that amendment then seconded? You proposed it. Jodie, you happy to second? Yes. Yeah, okay.
Does anybody else have any more recommendations? Are we happy to vote on them collectively or take them individually? Yep. Can we please take a vote on those recommendations? Thank you. And thank you very much, Chief Executive and Gronya. Congratulations on the Binfield Community Centre. It really is great, and I look forward to seeing it full and busy. Great. Okay. Agenda item 8, the transition review scope. Councillor Watts, I think you're going to introduce this, please.
I am indeed.
Take it away.
Right, to give you the short, sweet version. So we were looking into what assistance young people in the borough had when moving from school into employment. There were a lot of positive findings that have been reflected in the report, especially the work taking place to support the young people at the risk of need, support for children who are looked after and those with SEND, which of course I was very happy to see. The panel concluded with 4 recommendations, and we believe that our recommendations within this report will further enhance the opportunities for young people in the borough so they can make good career choices after leaving school. The Cabinet invites the principal of Garth Hill College and local schools partners to develop a forum between head teachers, heads of sixth forms and sixth form careers leads. The goal of this forum is to facilitate collaboration and sharing of information and ideas relating to careers and opportunities for young people transitioning from education to employment. Our second recommendation is that if recommendation 1 is approved and implemented, a forum is developed and the Elevate team should present an annual report to the forum highlighting the destination data for those in years 12 and 13. This would also highlight how many people in non-learning education or training NEET across the borough to inform and develop ways to continue to reduce these numbers and to review in 6 months. And apologies, also review in 6 months on recommendation number 1. I missed that. Third recommendation is that the Skills Hub continue to be support in increasing the engagement with local companies to provide greater numbers of apprenticeships to meet demand, specifically the increase of local companies to provide greater numbers of apprenticeships to meet demand, specifically to increase the provision of level 1 and 2 apprenticeships to 150, based on the current need identified. and that a performance update is published on a 6-monthly basis and also shared with the Redevelop Forum as part of the Recommendation 1. This recommendation is dependent on the extension of the funding for Skills Hub beyond March 2025, which obviously is out of our hands, but, you know, fingers crossed, and to review in 12 months. The fourth recommendation is that the Cabinet ensures communication to each school relating to the value of developing and keeping an up-to-date register of companies offering work experience. They should ensure that schools are aware that learning to work can help manage placements for local schools. And this recommendation can be monitored through feedback from the forum proposed in Recommendation 1. Thank you. Any questions?
Yep, so we can now move on to questions of accuracy. Do we have any questions for Councillor Watts? No. Would anybody like to speak in debate on this? Not a hand. No. So, Councillor Watts, would you like to move the recommendation in 2.1 of the report?
Absolutely, Chair. Thank you.
And
I was going to say, in the absence of Councillor Barnard, who is Vice Chairman of the panel, I'm more than happy to second this.
Thank you very much.
Thank you, Councillor McLean.
And are there any recommendations made to that contained in 2.1? No, we haven't made any recommendations on top of that. So if we are all agreed, then we can take a vote on recommendation 2.1 that's been moved and seconded. Let's take a vote. Thank you. That's carried. Thank you to Councillor Watts, Councillor Barnard in his absence, and all the panel members for their hard work on this. The report is on the agenda for the Cabinet meeting on the 18th of March. Councillor Watts.
I just wanted to say that a big thank you to all the officers for all the hard work, and to my panel who all put in a lot of effort into this. It was a thorough labour of love.
Noted, thank you. Agenda item 10, the work programme update. So we start with education, skills and growth. ONS panel, we'll keep with you, Councillor Watts. Shall we do the health and care panel, and then Councillor Watts, you can get ready to do the education, skills and growth panel update if you have one. Otherwise, we'll go straight to health now. Councillor Eggleston.
Thank you, Chair. So we're starting our next review on the next Wednesday. What we'll be doing is formulating some questions ready to go across to Ringmead. So that's our next project we're working on. I had a meeting with Councillor Wright, and she gave me an update on what that she has been doing. So she let us know that we now have a new director for public health called Charlotte. That the obesity strategy is currently on hold for adults because the contract wasn't working, but it's still in place for children. She's been working with the Combating Drugs Partnership, how they're measuring success. And they're looking at the health and care plan as that's due to be renewed. Sandhurst Counselling post-COVID received a grant for mental health outreach. Have asked for that to continue. So that's what they're reviewing as well. She also went to Kerrith, Pilgrim Hearts, Christians Against Poverty and Home Start. And she also went to Waterfield Practice with Councillor Welch to discuss different things that were going on there. And also she was highlighting, obviously, that Pharmacy First is like that they're aiming by October to have done their review. And I'll finish it there, but we have got a JHOST update. We're going to do it next full council on March the 12th. But really pleased to say that the extension to Frimley is there. It's ready to be opened in April. Another 76 beds and 44 car parking spaces. And it's very AI orientated. And we will be going for a visit there very shortly. So thank you.
Thank you very much. Does anybody have any questions for Councillor Eggleston? No, thank you. Councillor Watts, are you ready?
Yeah, sorry, I have nothing to report, Chair.
Okay, thank you. Councillor Eberle, Environment and Communities Panel.
Yes, oops. Yeah, that's on. We have currently a social housing scrutiny review going on. Last meeting was on January the 9th. I did not participate in this one. This was chaired by my vice chair, Councillor Foster. Councillor Foster briefed me and said while they made good progress at the moment, they are on hold due to officer availability. Obviously, there's a bottleneck, and well, good progress has been made, but this needs to be continued. Further, there's an action on the Environment and Communities panel to decide on the further work plan for 2025 and 2026. I got the email. It's on my mind, and I'll report back in the next panel meeting. Yeah.
Thank you very much. Does anybody have any questions? No. So we'll close that section of the agenda. And just before we close the meeting, the next meeting of the Commission isn't until the 26th of May. But it's timely for all the panels to review their work programme. So we've asked the officers to get in touch with all the panel chairs to organise the meetings. So do get involved and review the topics for the next 18 months, as we've discussed. We also have some O&S training on the 24th of March, which is being delivered by the Local Government Information Unit. And many of you have already indicated you're attending, but I certainly am looking forward to that so that we can all improve our O&S skills. So thank you, everybody. Oh,
sorry, just one thing, Chair. Just that we've been in contact with the Public Protection. Damien James, Head of Contracts, has asked us the Public Protection Partnership review. So I think we just need to sign off at this commission that you're happy to amend the work programme slightly. I know you're all going to look at it, but just that it's okay for the Environment and Communities panel to look at the Public Protection Partnership review that's been requested. It's a change to the work programme and it's imminent, so if you could just agree that before the work programme is looked at by the panel, that would help. Is that okay?
Yeah, well, no objections. I mean, it has to be done.
yeah, I don't have any objections, so. So yes, thank you for that, and look forward to seeing you on the 24th of March, 22nd of May, but thank you for attending, and we can declare this meeting closed.